Okay, we are live tonight, the 19th of October 2024, and I am in the company of Dr. Zwi Ngema. We are discussing a wide range of questions and answers and discussion. And if you are joining us online, please write your question so that we are able then to answer your questions. We would like you to interact with us, and those that will be joining later. When you join later, I know it's weekend, many people are doing a lot of things. But when you join later, please continue to ask questions, continue to share this broadcast so that others may receive it and continue to comment on the broadcast. As usual, my name is Dr. Stanley Maposa. I wear a few hats with me here, but in these discussions, I am the patron of the Shekinah Legacy Foundation, a lived experience foundation from our side that in 2022 we lost a son based on mental health challenges, and some of you may know, and some of you may not know, and we are using this organization called the Shekinah Legacy Foundation to continue our healing, but to turn our pain into a purpose and also our loss into a lesson. The work that we do at the Shekinah Legacy Foundation really spans across three areas. The first area is the awareness creation on mental health and ensuring that we destigmatize this phenomenon. The second part is therapy, ensuring that people that are having challenges with mental health receive the therapy. While we are not trained as specialists and practitioners ourselves, we partner with people like Dr. Zwi and others to ensure that people receive professional counseling, and we'll talk about that later. And finally, we are into music, and we support musicians that are gifted but are struggling in the area of music, because our son was a musician himself. He had recorded various artists from his bedroom studio, which we are moving right now to a public space. And we are also using music itself as a tool to create awareness and therapy, because South Africa is a musical country and Africa is a musical country. Certain things that we speak are not heard until we sing them. But all about me for now and the session today. Dr. Zwi, I want you to introduce yourself and let people know who you are, where you hail from in terms of experience, work, all that, everything that you think is suitable
relevant
for like this one and relevant. And over to you. Thank you.
All right, thank you. My name is Sizwiwe Ngema. I'm originally from Durban, and I currently work at Tembisa as a general surgeon. So I'm a mother of two, a child of God, and most importantly, which is relevant for this, is that I suffer from major depressive disorder, which was diagnosed earlier this year. So not only have I worked with people who have mental health issues, I found out recently that I was suffering for a long time with a mental health issue. So I'm very uniquely placed in this situation to be able to talk about this. And thank you for the opportunity to be able to come and tell my story and basically my perspective of it, and also the academic and medical part of it.
Wonderful, wonderful. I like two things that you have said there, Dr. Zwi. That number one, you're a child of God, and the Shekinah Legacy Foundation is a Christian organization. And that does not mean that we discriminate other faiths and other religions, but that's our identity. But secondly, you also talked about a lived experience, which for me is interesting in the sense that a lot of people speak about things that they do not know, and in the process, they make assumptions and perceptions and fallacious statements that don't help anyone. So we have the right people in the house, and I see others have already joined. Dr. Zwi is here with us. Me and you and I met, Dr. Z online
Mm.
through the Hope radio, Hope Alive radio. I think you remember when
Yes.
we were in the studio with my
Mm.
daughter Rejoice Nozuko, who is the chairperson of the organization. And you indicated that you want to come through,
Mm.
want to support this work, and I want to really appreciate your commitment to that. Thank you so much. Okay, let's get into the subject matter. And as you describe some of these things, you'll really put in your practical examples. As you have said, you are in the
Mm.
lived experience space. What is this mental health, Dr. Zri? And many people do not understand the concept itself,
Mm.
because when people hear this word, they think we're talking about madness, as we say, as we call it in layman's terms.
Mm.
Some call it being crazy, or they are really thinking that we're talking about all that. Maybe we are, but it's a bigger picture, and we want to know what it is in terms of definition, and how it really impacts us on a day-to-day purpose, on a day-to-day life. Not only those people that we then begin to see picking up bits and pieces of paper and they are dirty on the roadside, but
Mm.
all of us anyway. Over to you. What's the definition?
So, according to the WHO, which is the first resource that I use, it's basically, I'm going to read it so that I make sure that it's right. It's mental health is considered a state of well-being that enables people to cope with the normal stresses of life. So it enables people to be able to realize their abilities, to learn well, to work well, and more importantly, to integrate into society and to contribute to their community. So your mental health allows you to basically function in your society, in your community, in your family. Not only, is it beneficial for your general health, because obviously there's behaviors that are associated with poor mental health, but it helps you make decisions that on an individual um, and a collective level, it helps you make decisions that are beneficial to yourself, your relationships, and your community. And that's the definition that the WHO gives. So obviously, if we put it into context, I like to basically, when I started thinking about my own mental illness, I basically put it in to my own setting, because obviously we're talking about how I impacted community, how community impacted me, how my relationships are impacted, how relationships impacted me. That's how you have to think of it. Is how did it impact my health? How did my health impact my mental health? So it works hand in hand. They work together. The WHO does talk about there's protective factors, and then there's risk factors. So, and there's global risk factors and community and individual risk factors. So, for example, if you are in a war space where there's a lot of death, dying, disease, famine, etc., a lot more people will feel or experience mental health episodes of mental health ills or lows in their mental health. It doesn't necessarily mean that everybody's going to experience it, but at the same time, you can live in a comfortable place where there's no war, no famine, you can have two parents, etc., and still get a mental health condition. So it doesn't mean that because there's risk factors and protective factors that I can't get it because I don't have any risk factors. That's not the case. How does it? Your second question was how it impacts us.
Yes.
Like I said, it really it impacts your day to day. First of all, there's something called quality of life, and we know what quality of life means. As in, there's a whole scale that you can check to see if a certain disease or a certain disability will impact your quality of life. For example, if I'll bring it back to the surgical sense because it makes people sort of understand clearly. If we want to operate a patient, we check to see how much of this operation will impact their life and whether or not they will, if we take off a leg, for example, how much is that going to impact their life if we don't operate them? Will their life be extended? In the very same way, we need to look at mental health in that sense. How much is this mental health impacting their life? Is it impacting their income, their relationships, etc.? So on a day-to-day, if you can't wake up, for example, in my case, major depressive disorder, if I can't wake up, I become an inconvenience at work. I may even lose my job. But the fact of the matter is, I don't have the strength to get out of bed. If I were to be disabled and I didn't have a leg and therefore I don't have the strength to get out of bed, a lot of people would take me more seriously. If it's the very same impact, but the cause is different. So it impacts day to day the way you. Oftentimes, people are disappointed in the way you're treating them, but your interpersonal relationships become impacted. People don't understand because they cannot see what's going on inside, why you are behaving like this towards them. There's a concept called insight. And obviously with the mental state, like I said, the WHO defines it as a mental state. We even have something called a mental state exam, where we check someone's progress, just like we would check their pulse, we would check their heart rate. It's called a mental state exam that they use in psychiatry. And that checks your insights, your judgment day to day. So a person doesn't have insight that I'm treating my parents like this or I'm treating my children like this. And that's an impairment in mental health. It's part of the things that we check when we check for treatment. If we were to put it in a physical setting, we check, is the patient healing well? Are they getting physio well? And if you look at it like what it is, a condition or a disorder, you start to, and put it in a physical sense. What if I lost my arm? What if I, those are the kind of impacts that we need to start looking at mental health as in the society.
This is amazing. And you have already answered part of my question. I'll ask it nonetheless in another space to say, when we talk about mental health, many people, especially as I've been doing this for 3 years or 2 years now, many people have challenged me that this is a new thing. This is something that is coming in now, and they don't understand it. And do you believe that this is a new phenomenon, or is something that has always been, and maybe the awareness or something else has not been right, so for people to comment that it's a new thing?
I don't think it's a new thing. I mean, if we go back to Bible times, you sort of understand that certain people were treated in certain ways because they were deemed, crazy, or they were deemed unwell. Oftentimes they talk about demon possession. We don't really know whether it was this or that, Other people have classified it as other things, traditionally speaking. But I think that the first, as I was researching for this topic, I looked up when the first DSM, the classification that we use for the disorders, the first DSM came out in 1959, the actual DSM-1 or DSM. We're on DSM-5 now, obviously, because of research and changes in terms, but it came out in 1959, and on the preface, it was commenting about the fact that the DSM was structured and it included accounts and sentiments from World War II. So you can imagine there was a major risk factor that happened, and all these conditions prompted this to be written. So even back then, there was an understanding this is more than just physical. A lot of the time, though, and I'm sure we're going to get into that, the lack of understanding comes from lack of, like you said, talking about it. And also there's this sense of I need to be strong, I need to be strong, I need to be strong, especially with the subtle ones. With personality disorders, people say, no, they just like that. I know they just mean like that. Oh, they're just violent like that, Meanwhile, there's actually a personality disorder. There's a lack of insight to the fact that this person is not violent just because he has, antisocial personality disorder, which can be treated. No, this person is just, you call them like the histrionic personality disorder. No, they're just flamboyant. They're not flamboyant. There's a personality disorder to it. And obviously, there's a a lot more people are talking about it because of the fact that so many lives have been lost by leaving it alone. So much harm has been done by leaving it alone. So much, underlying, with addictions and substance abuse, all those things are coming to light now. It's becoming a huge problem. And obviously the world is looking at it and saying, what is the cause? And they can't find, they can't draw blood and find a disease. It had to come to light because of the fact that when it was ignored, lives are being lost.
Wonderful, wonderful, wonderful. I like, how you trace that it has been happening from biblical times. We see people that have some action that would call mental health challenges, but also in 1950 when a major world war happened. And I think maybe now, as people are talking, COVID-19 has had an impact. And it has been a major issue that really affected people's livelihoods, people's relationships. Other people could not bury their loved ones, all those things we're working with. And as a result, we have many people that really have a challenge around mental health. What's your comment about that?
Definitely. I mean, people talk about marriages being broken because of COVID, but there was so many risk factors that were introduced. There was economic risk factors. There was fear and anxiety about death and unknown. There was obviously we as humans, we function in a society, and before COVID, we had a normal way of functioning. You went to work, you went to school, and now you're stuck not knowing when your next paycheck is coming, when you're going to see your friends again. There are kids that were separated from their families. There was a whole lot of stresses. And mental health obviously is, coping with the stresses of life. There were just so many concurrent stresses that were happening. You know that your family member is sick, but you can't go and see them. There were many stresses. There was underground, substance issues, cigarettes, alcohol at higher prices. There was, you get what I'm saying? Like, a lot of people had a lot of time alone. And another thing that people don't understand is that life is a distraction from your inner work and what's going on inside. So when people were placed in a box, some people in solitary confinement because they stayed alone, they got a sense of, I'm losing my structure. And we were all in the same situation. Fortunately for me, I could drive to work because I was an essential worker. We all had stability from our side as, essential workers, and our income was sorted. But that didn't stop other doctors from feeling depression. People were burnt out. They were overworked. They were, we were doing things. Obviously, I'm a surgeon, but we were doing COVID tests. We were, grappling with vaccines, trying to get our people to take the vaccine, not take the vaccine. There was rumors. There was a lot of stresses at that time, worldwide. There were people dying worldwide. There were people that we know that have died from it. Stresses that we hadn't experienced at all before. So I understand that COVID-19 was quite for mental health. It was good in the sense that people are aware that it's not just the crazy ones that were struggling. Everybody struggled the same.
Yes. No, I like that contextualizing of the matter. Let's go back to the terms. You say DMS or MSD. Maybe clarify that one, but go on to clarify some of the terms. DSM, yeah. What does that stand for?
DSM, it's a diagnostic and statistical manual for psychiatric disorders. So it's their criteria that they use to call it an actual disorder. So, for example, you can have personality traits, and I know you've heard like narcissistic personality traits, but they don't have the disorder. They can be obsessive compulsive, but they don't have the disorder. So it's just a manual that helps define it as something that is moderate to severe and needs to be treated versus something that can be managed at a psychology level, for example.
Okay. You're going exactly where I want us to go, to say there are terms here that one would say, I have a mental health challenge. And the next day you hear someone says, I have a mental health illness. And then
Mm.
the third day you hear someone says, I have a mental health disorder. So what's the difference between this continuum? Are they meaning the
Mm.
same thing, or the severity differs? And what's the difference here?
So I'll start with the ones that I think people want to know the difference between illness and disorder. There
Yes.
actually isn't. If you Google it, there actually isn't. But we're moving away from illness when we talk about it um, as if umuntu uyagula ngekhanda. We're moving towards more disorder, but it needs to be understood as an illness, just like diabetes, just like hypertension, just like heart conditions, just like in some cases cancer. We need to understand it as an illness, as in it needs treatment. But we're moving away from the word illness because of the stigma, and we're moving towards a disorder. Now, disorder, basically, like I said, it's your interpersonal relationships, it's your mixing with communities, it's your ability to work and learn. Disorder basically describes disruption in that. So
Okay.
your mental disorder, or your like those, like I said, those can be used interchangeably. You've gotten to the point where your depression is impacting your life, your income, your ability to learn, your ability to form, maintain, and continue relationships. All of
Okay.
those things. If I will take another disorder, for example, you can anorexia is considered a mental disorder. That disorder is impacting their lives because it's messing with their physical health. This person, most of the time, you'll see anorexics, they're tired, poor memory, poor cognition, poor interpersonal relationships because of the how they feel about themselves, low self-esteem, those kind of things. It's literally affecting their health. Um, and oftentimes with the disorder, there'll be concurrent things, like I said, cognitive disabilities, substance abuse and addiction, all those like being recluse and things like that. It affects your framework and how you interact with society. Mental health challenges are what we would define as a pre-mental health disorder. So yes, I have a challenge. Maybe you have anxiety. You can't talk in front of people. You don't necessarily have panic attacks, but you panic when you're put in a situation that requires you to talk in front of people. So a challenge is basically, I know that I have this weakness in my either my personality or my interpersonal skills, but it doesn't necessarily impact me from going to work. It doesn't impact me from asking for the cashier to give me change. So a
Yes.
disorder makes you completely dysfunctional in society.
Yes. I like that. It's really making this very clear, because language is very critical on the
Mm,
positive as well as on the negative. Let's look at the negative a little bit of language. Can language usage, in the family, in the workplace, in the community, in the church, bring about stigma around mental health? I'll give you an example before you answer. That
mm,
people would say, we are kulekanda,
mm,
upambene,
mm,
all those words, when somebody is trying to explain that I've got this thing. Would that then cause somebody to shrink and be unable to then speak out, and bring in
mm,
stigma? You talked earlier about in the church spaces, when somebody would say you have a demon, uh,
mm,
and you must pray more, you must fast more, you must read more the Bible, and many other words. Words are so strong, they
mm.
can liberate you or they can bind you. Do you think that's accurate? And what examples would you give as well?
I think I have so many examples from our lives, as like my life, everyone's life. But yes, words are extremely important. And honestly speaking, I don't think that we've had enough education around the use of words for mental health people. As you know, I work in a hospital, and we use the term MHCU, which means mental health care user. So, or we'll describe it as GCS 14, 15. There's something called a Glasgow Coma scale where we check someone's level of consciousness. So we'll say I GCS 14, 15, but usually those people are disregarded, put in a corner, sedated. You know, the security guards would say, security guards, you work in a hospital. There's no education around them who work in the hospital. A cleaner can go up to you and say, you know, as a mental health care user. Lawyer, and the thing is, this person is in a facility where they need care, and those words are what they've been hearing on the street, what they've been hearing in their home. And then you come to a health facility and there's no education for the people in the facility. How much more outside in society? A lot of the time in Black communities, if you have depression, we know this. My family was very, very, I told them very late. I was very ashamed of the fact that I had depression. I know I had the symptoms, but I was always, being strong, get yourself up, go, you must push through the pain, you must push through whatever. You get told especially a Black woman who's going through things, if you're going through a breakup and it hurts, get over it. He's probably over it. You get told all these things, Uguti. I know, with depression, I mean, it's you get told you must just suck it up, suck it up, suck it up, and you can't suck it up at some point.
Yes.
My depression manifested not in a way that people think. I was depressed, yes. I wasn't able to wake up in the morning and stuff. My depression actually manifested in the fact that I was starting to fight with people. I fought a lot with people. Someone who I usually got along, and I started to fight to the point where my manager was like, no, you need to go see occupational health. I didn't even pick it up. I thought I was pushing through. I'm at work. What do you want me to do? I'm at work. I'm working, but I'm fighting. My interpersonal relationships with my colleagues was horrendous. And it's those kind of things where you must just change your behavior. You must suck it up. If you have a panic disorder, I know. I very sensitive, lo muntu. Sensitive. You get what I'm saying. There's a lot of brushing off because of the way people use certain words because they have a lack of understanding. We are shana, velu no jame. There's all those words that just put you in a box. You actually dealing with something, and you might not even realize it, but the people around you also will just write it off. Meanwhile, they're actually feeding into this thing that they're feeding into the stigma around mental health disorders. A lot of young boys have antisocial personality disorder. These young boys that get into trouble at school. Meanwhile, there might actually be a serious disorder behind it. So when we look at people with their extreme behaviors, we should actually not label them as, I value na manga, or rather, the fact that they might have, some sort of bipolar. And in the church, it's particularly difficult because it is prayer about it. It is amadimon. It is God is your joy. And I do believe that God is joy. But to access that joy when you're that deep in your depression is very difficult.
Certainly. No, I in everything, as you are saying, language is powerful. We can either build through language, we can either destroy through language. And the Bible is clear. It says life and death is in the power of the tongue. Tongue is the power for life and death. Something like that. I'm not quoting the scripture well. But let's go back to discrimination and stigma. As you have rightfully put, that language is one of the things that does that. What are the other things that really bring stigma as a major barrier to mental health, and this discrimination that shows up in different areas of our life? We're talking about the home, we're talking about the workplace, community. You're talking about in the workplace, you have mental health, illness, and here comes promotion. Everybody says, no, we can't give Stanley.
Yes.
While he's good, he's got a challenge. He can't do it. And promotion passes you. You get to a
Mm,
home set up the same language. You go to the street, the same language. You go to church. Do you think
mm.
there are other causes of stigma? And maybe the question is, how do we address this thing so that we finally reduce
Mm.
or totally destigmatize mental health?
I think it's very hard. I mean, if we look at how long it took, and still today, but how long it took to actually destigmatize HIV in this country, which is a disease that can be tested, measured, treated. It took so long to destigmatize HIV, and they're still destigmatizing it. And mental health is a lot harder because the person who's suffering has to know and accept that they're suffering from a mental disorder.
Yeah.
And that in itself, it starts within with people who have mental health disorders. They develop low self-esteem, low self-worth, and obviously if you have something like depression, you feel like you have failed at being strong. You have failed at surviving. Someone is struggling at school, and you have failed at school because you have this condition that you don't want to accept, you don't want to get help for, and you sometimes you can't. You like, I can't study. You think you're stupid. You think you get all these thoughts and things in your head. Someone with schizophrenia, they're hearing voices. They don't know whether those voices are their inner voices or just their thoughts, or is it schizophrenia. And they think everybody hears voices that tell them negative things, because they don't come out and say, yo, I'm hearing voices, they're telling me to do things. One of them won't say limas
Mhm.
or is hurting someone else. They get this paranoid schizophrenia where you just see someone, for one day they're acting erratic and then the next day they're hurting someone, you know. So you get into that situation where the person has to accept, I have a problem, this is not normal. People on schizophrenic treatment, they'll tell you the voices don't go away, they just become manageable and less, like every other condition. The voices don't go away, but they don't become negative. um, and I think it's one of those things where sorry, I need to wipe my nose. But it's one of those things where you need to accept it for yourself. And once you accept it for yourself, and more people say, hey, I don't have depression, but I've had a depressive episode. um, I don't have this, but I've struggled with substances before. The more that people talk about it, and the more that people see that, oh, this looks like something that someone's already experienced, I think society will go far. But it requires verbalization. The thing about it is that you can't examine someone and see, okay, it requires the symptoms requires you to verbalize before they get severe. Men are a lot more prone to severe mental health disorder because of the fact that men don't talk. They're taught to be tough. They're taught to not speak. You can't cry too long. You can't do this too long. You can't do that too long. Men are taught to be, you can't express your emotions. You must fight. When you're angry, you must punch. So society has created it in such a way that it's difficult for men to say, I'm vulnerable in this place. I'm weak in this place. I'm feeling failure in this place. So men present a lot later. A woman will present a lot sooner because they've spoken about it, and they're more likely to seek out health professionals first. They're more likely to advise each other on seeking out health professionals. I have because a man will hear that from someone and be like, how much more, a man will have, chest pain for 3 days. Come to find out he had a heart attack 3 days ago, and he just didn't want to seek out help. So a lot more men are suffering. A lot more men have societal pressures where um, they have to be breadwinners, financial issues, going to war, for example. A lot more men were affected by that. A lot more men are those breadwinners that if their income is lost, their value is lost. And all of those triggers, without talking, without being able to verbalize, without seeking help, will lead to a lot more men having severe symptoms more than women, or ultimately severe repercussions like self-harm or death.
Wonderful. Let's take some few questions here. I really enjoy this discussion, and you are really explaining some deep issues that I wish and believe everyone is following and taking this particular subject seriously. And one person that is following and taking us seriously tonight is a man called Ndumo Ncube. And he has written already 2 questions. I want us to go to them before we
Okay.
proceed with others. The first one I've projected there, you can see for yourself, says, how do you maintain mental health? I mean, things that boost mental health.
Okay, so from personal experience, it depends on what the mental health issue is. But I'll take it from a depression stance. When I had a depression, like I said, I was actually admitted for it. I was 8 months pregnant at the time, and I was a single mother. I had already had postpartum depression, so that was a risk factor from a while back. And then I had this subsequent pregnancy. They do a lot of mindfulness activities, but I'll try and explain it from a systematic point by point thing. First of all, figure out what the mental health issue is. What are you struggling with? Is it anxiety? Do you have fear? Do you get panic attacks? Is it an attachment issue? You know, there's some people that can't make decisions at all without having someone there. Like they have this a mental disorder that's associated with attachment. So you need to figure out what it is. If you don't know what it is, or you tell someone your symptoms, like, hey, I really for the past couple of weeks, I haven't been sleeping well. I haven't been eating well. I don't know what it is. Tell someone your symptoms, and then they can work it through with you. What if it is anxiety? I every time I close the door, I feel like konozongena because something happened before. That's related to PTSD. A lot of people that have had, sexual things happen to them, sexual triggers. They will find that they struggle with intimacy. They struggle with, intimacy in their relationships, or they struggle with self-worth. So figure out what the mental health illness is, and just verbalize it so that you can have coping mechanisms. There's different coping mechanisms that you can do. But in a general stance, there's journaling. I have a journal that I've had for years. I write letters to God. Some people write letters to themselves and journal. You can journal, paint. I'm a painter. I draw. I also write poetry. I write short stories. But I've been on my mental health journey for a long time. Also, and coupled with that is your lifestyle choices. So the foods that you eat. People think that it's just, no, we keep on saying eat healthy, but a lot of sweet sugary things like chocolate. I love chocolate. I eat chocolate every day. I'm not going to say don't eat it, but those endorphins that get raised, you get used to wanting endorphins. When you feel bad, oh, I have to have a drink. I can't stay without a drink. That coping mechanism that is unhealthy. I'm not saying don't drink. I'm saying don't make food a coping mechanism. Eat right, so that your body, your physical health is maintained as well. Because if you start getting physically unwell, your mental health tends to follow. It really does tend to follow, and people don't understand the correlation. I've seen it. Like I said, I'm a surgeon. Once we give a patient a stoma for injury or whatever reason, where they have to poop in the bag, their mental health declines significantly. I'm actually doing my research on it for the program that I'm doing. Their sexual health decreases significantly, and that's a physical change that's causing a mental health issue. Regularly checking in with, like I said, mindfulness exercises at home, writing, journaling, painting, gardening, whatever you can do with your hands just to make yourself feel better, instead of grabbing that drink or grabbing that unhealthy, coping mechanism that you've had before, is helpful. Physical exercise helps raise your endorphins. Also, it depends on your personality as well. I'm more of an introvert, so I stay indoors when I want to recuperate my energy. I watch movies, I do whatever will recuperate. If I'm socially tired and my battery is low, I tend to fall into a depressive state. like if I feel like I've been overwhelmed. My sister is the exact opposite. She's an extrovert. So when she feels bad, she picks up the phone, she calls someone. She picks up or she'll go out and have lunch with someone and then she'll feel better. So whatever your personality aligns with, do that. A lot of times spiritual health helps as well. I have gone through depression where I didn't want anything to do with God. I was angry, I was upset with the situation that I was in. And I found that now, looking back, my mental health is so much better because my spiritual health is better. Whatever you believe in, your spiritual health and connecting spiritually with your maker, your creator, whatever you believe in, it does help a lot. And then lastly, I recommend that you seek out psychological help, whether it's counselors, like you said, counselors that don't necessarily, obviously, counselors have like various qualifications. They can be from the church, they can be from foundations, they can be from whatever. Seek out that aspect of, I need to talk to someone who I can trust, who knows stuff. It really does make a difference. Before I got my diagnosis, I did not take the field of psychiatry seriously. If you look at the levels, there's sort of like inside jokes when you're in medicine. Surgeons think they are God and everybody else is underneath. So I didn't take anybody who wasn't a surgeon seriously. Like surgeons here, anesthetists here, anybody else, I don't regard them until I needed a psychiatrist. That woman changed my life because when I first 3 days of my admission, I was crying every day. And she was asking me the same questions. How do you feel? How do you feel? And we'd get into it for like an hour. By the 4th day of my admission, I was like, I'm ready to go. Yes, there was medication involved. And if you need medication, please do take it. Even if you feel better, just take it. It's like diabetes, hypertension, anything. Take it even when you feel better, because when you don't have it, it's life-threatening. But you need that psychological support. I have a great support structure. My siblings are all there, you can see. I have a great family, and I still needed all these other things to help me as well. Yeah.
Amazing. I think you have done a good job. It all depends on an individual. And some of the things that Dr. V has explained here may be applicable to you, and some may not. But the crucial one, you need to find someone to talk to. You need to find the help, and help is available. Let's take another question from him, and then we will move to the personalities and the persons, sort of the stuff that is in the mental health arena. So he says here, the second question, there are people who don't have selective words when speaking. Some don't even have discipline. Will we consider that as mental health? I think he's talking about people that just insult and just speak anything anyhow. Would you consider that as mental health? I think he was following the language thing. What this the language thing?
It depends. So if Kona, or if Kona Goko, who has reached her age, like she's 80, and she has no care for how people, how they're feeling, what their feelings, and you won't call her, you won't call her mentally ill. Because you understand she's not hurting anybody. She just doesn't know how to structure her words anymore. And at that age, she doesn't need to. However, there are people that are liars, they are manipulative because of their mental illness. They are harsh because of their narcissistic personality disorder. So, with the personality disorders and what he's describing, it's very subtle because you can have narcissistic traits, like most bosses and CEOs are considered to be harsh people who don't know how to, speak to people, who don't know how to speak to their staff. However, they're good husbands and they're good fathers. So they're not necessarily, they don't have a personality disorder because the company is functioning well. They're just disrespectful. Their kids are happy, the wife is happy, he's probably a leader in the church, etc. That person is just disrespectful. But if that same narcissist has no regard for their children, has no regard for their wife, is unable to integrate into a church community. Wonke umuntu uyamzonda. But it's the same type of speech, but it's affecting all aspects of their life and the way they blend into community. Then it becomes a mental health disorder. I think I've answered the question.
Yes, very, very well, very well. You have really answered the question. Let's move to the professionals. You had already started talking about, the surgeon as the king and everyone else.
I don't think that anymore. Okay, I'm reformed. Everyone is equal. Everyone is equal now.
I teach at the university and I teach engineering students.
Mm.
And they also say the same thing. They say, no, we engineers are the best thing that has happened because everybody else is solving problems. Tina, we create solutions to solve problems. So we are higher than. They say they are not scientists. Scientists are lower. Engineers are above. Because, yeah, and I think when you go to teachers, they'll say the same thing, and everybody else will say that. But let's come to the mental health profession. Who is who in the zoo? Who is who in the zoo? You talked about counselors, you talked about psychiatrists, there are also some called clinical psychologists. Who is here in the zoo so that the listeners would know who do I approach and who do I approach last? And there's also fear around these names because the psychiatrist is called Dokotela Wenhlanya. And if you see this particular doctor and you are referred to there, you don't want to go there because are there some steps towards that? Maybe take us through in terms of just unpacking this environment so that the listeners here would know if you are looking for help, where is the starting point? What do you do?
Okay, thanks for that question. If I lived in an ideal world, I would think that everybody should be able to start with a GP, like a cold or a flu, and go to a GP and say, I'm not feeling well. And the GP would be able to pick up that this person has depression. Unfortunately, our health system is not set up like that. Because in my mind, having had both, I've had physical illnesses and mental illnesses, they affect my life the same. So I wish that we had more insight into be able to just walk into a GP. There are some that can be able to pick it up with, okay, this person isn't sleeping well and they're not eating well. And no, it might be a mental illness rather than just a physical illness or a flu that's coming on. I wish we had more of that, but unfortunately we don't. So currently in the health system, we have what we call counselors, and I think counselors do a great job. Throughout my life, I've been to church counselors. I've been to all the structures. Mostly, we'll start at the counselor level. So counselors are people that don't necessarily have a qualification that's related to psychology. So it's either a nurse or someone in the community or someone with a foundation who has a background in some sort of qualification. Doesn't necessarily have to be medicine or doctors, but someone who has a background in some sort of a background somewhere or some sort of training where they're able to basically provide more like a beginning point in a time of crisis. Yes. So you can, there's people on the phones that you can pick up, there's hotlines and things. Those would be considered counselors. They don't necessarily have to have a degree or something, but it's a first point of contact. And they're available at schools, they're available at clinics. Sometimes there's community outreaches and foundations. It's someone there to be your first point of contact when you are in that beginning phase where you don't know what to do, like you're saying. Where do I go? You can easily just Google and say, do you have counselors? Churches have counselors. They have marriage counselors. They have all sorts of counselors. And usually good counselors and people in those environments will be able to see that this person needs a psychologist. So the psychologist is someone who studied a master's degree in psychology. There's clinical psychologists. They're the ones that work obviously in the clinical setting where they're in a hospital setting or clinic or whatever, where they're dealing day to day with those patients that are present there. There's some people that work in their private offices as well. They're also considered clinical psychologists. They work every day. There's some psychologists that specialize in other things, like pediatric psychologists, where they deal with anyone who's below the age of 18. A very important age group, but it's a very subtle age group as
Yeah.
well. They can also diagnose like other learning disorders and stuff. There's educational and occupational psychologists as well. But it's someone who's able to treat mild to moderate, moderate to severe um, conditions or mental conditions, but they use coping mechanisms, counseling, psychometric things rather than giving medication. They are able to diagnose. They use the same criteria that psychiatrists use, so they can tell you you have major depressive disorder. This is how bad it is, but they can't prescribe medication. They can also suggest and facilitate admissions to hospital with families. They can also do family counseling. They've studied this and they understand pretty much the same way that a doctor would the chemical imbalances and the health risks that are associated with the condition. They just don't prescribe. Then obviously we get the specialists, the psychiatrists, my besties now, but they diagnose, they treat biopsychosocially, and they work with psychologists quite closely, because the psychologist will give you the coping mechanisms, the mindfulness, journaling, things like that we've spoken about, and other tools that they use as well, tools that they introduce into the families as well. So they work very closely with them, but medically speaking, they're the ones that diagnose, they're the ones that admit, they're the ones that check the pulse, using the mental state exam. Ultimately, they're the ones that essentially keep people in hospital. Psychologist is a good place to start if you obviously have medical aid. Some schools have psychologists, universities have psychologists, and they have mental health care facilities where you can go. But a lot of the time, especially in private, psychologists costs money. So reaching out, like I said, to foundations, universities, and some schools have those settings. And you can even go to the hospital and see a family medicine physician who can refer you to a psychologist. It is possible. It's just that people don't know. And then they will decide if you need psychiatry. Psychiatry, obviously, they're the ones that can provide medications. They're the ones that provide, what we call ECT, which is where they use electrodes to stabilize the chemicals in the brain. Psychiatrists treat the chemical abnormalities. They're the ones that deal with the neurotransmitters, just like as a physician or one of those medical doctors would treat hypertensive medication. The psychiatrist will choose will treat the disorder with the right medication.
Amazing,
Yeah.
amazing explanation. If help is so available, Dr. Sui, and support is available for those who need it, what are some of the things that really prevent members of the society from accessing this kind of assistance? Obviously, the first one is the awareness. People do not know where the lack of knowledge, where there's no knowledge, people perish. It's not about only the knowledge of the Bible and verses, but if you don't know nothing, you will perish because you don't know. But what are the other reasons maybe that you can suggest?
I think I'll split it into community, public, and private, because I think that's a better way to understand. In the community itself, besides the fact that there's, like we said, there's awareness, but there's also stigma around the fact that I have this person. Obviously, there's some mental disorders that come from, having disabilities, and a lot of people hide their shame. They hide their aggressive brother. They hide their they drug abusive brother, for example. So they don't even want to. They know, there's an awareness that we have a problem in this house, but we keep this shame in our house. Um, we don't want to expose our problems. We don't want people to know our secrets. We don't want them to be seen at the clinic. We don't want them to be seen at this ward. You admitted, things like that. And I've heard things like that where people are like, no, I have someone who's admitted in the medical ward. They're shouting it to everyone. And you're like, why are you telling people that someone's in the medical ward? But that's how community is structured, especially Black community. And I would say Emalokshin. In the suburbs, you don't really know each other to that point. But Elokshin, everybody knows, oh, Khalsban ban lana, low petwe low fundala, things like that. So you have that. The community will prevent you from seeking healthcare because you want to cover your shame. You don't want to be seen in this situation. You don't want your family to endure that. Then there's obviously the public setting, where unfortunately we do not have enough psychiatrists and psychologists, and there's not enough research or budget allocated to mental health, because you're presenting, most people that come to public facilities, they're presenting when they've already taken the overdose, when they've already tried to harm themselves, when they've already got into a fight and been stabbed in the chest. And most times, as if they're presenting with something that's outside of psychiatry, we don't even involve the psychiatrists. There was I'll give you an example from just 2 weeks ago. There was a patient that came in who had his second suicide attempt. And obviously, if you go for the major depressive scale, he's scoring like 90% on the scale. This person has attempted to take their life. That is a severe, that if you haven't heard anything else about sleep, eating, going to work, etc., if you've heard that this person has tried to take their life twice, that becomes a condition. It's just the same as it becomes a major condition. It's just like hearing someone has had 2 heart attacks. You don't play around with that person. But the people that I was working with were like, no, let's not start him on antidepressants. We don't think it's that bad. I'm like, but he's already shown us that he's a major depressive disorder. Yes, the psychologist were called and the psychiatrist was called. But if someone had 2 heart attacks in the ward, we would immediately start them on heart medication. They need it now. So there's no sense of urgency, and it's not well funded, well researched, and that's the reason why there's such a lack. The amount of car accidents on a Friday night will far outweigh the 2 completely psychotic patients that are coming in. You get what I'm saying? So a lot of our resources and a lot of our doctors are allocated towards the things that we can see with our eyes rather than the mental health conditions. And then in the private sector, it's a lot better. Admissions are structured. You can just walk in and you'll be helped, and etc. Private sector is a lot better. The structures are there. The mindfulness activities that you're not going to get in public are there in private. The issue is finances. How many people have access to those kind of finances? And even in privates, you go to a private GP or a private psychologist, they can miss the fact that you need admission, for example. So there could be a lack of expertise there as well. But all in all, we have a lot of work to do on the ground. I can admit, and I can concede that we are still in our baby steps and stages of dealing with mental health on a provincial and a national level.
Wow, that's amazing. We have a minute left in our time allocated.
I'm sorry for taking up all the time, but
I just want you to wrap it up and say your concluding remarks, and we close the session.
Okay, thank you. Thank you for the opportunity. Thank you for letting me tell my story, and thank you for having me be part of this. I'm really passionate about mental health, and you know what? I want everybody to say to everybody that you're not alone. Please get help. It will make a difference. Like, I'm glowing now. I know I didn't say it before, but I look amazing now. And if you had seen me 6 months ago, I look completely different. And it just takes getting treatment to help you. It really does. Like getting those things, understanding that you have a condition that is as serious as everybody else's, and you should take it seriously. Yeah.
Thank you so much. Thank you so much. I like that conclusion that those that are following us and listening to us, help is available, and we have somebody
Mm,
who has done the journey and speaking a lived experience. You can also grow, you can also improve, you can also heal, you can
yeah.
also come out of the challenge. Don't take your life, don't kill
Mm,
yourself, don't harm yourself. Help is available, and talk to
mm,
someone today. And if you hear
yeah.
somebody threatening or promising that they will kill themselves, they have so many
Mm,
problems, don't take it as a joke. Uh,
mm,
make an alarm and just tell someone and get that someone helped immediately as possible. Thank you so much, Dr. Z. I would like
thank
to
you.
conclude the session and want to say goodbye to all the followers and listeners.
Bye
I
bye.
promise you we will come back to you one day and have
Thank you.
another.
Thank you so much. Bye, everyone.
Bye. Thank you.